Hello everyone, I am Dr. Prachee Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Today I will answer a commonly asked question: what is the right age for pregnancy, or what is the right age for IVF, and when should a couple consult a fertility specialist? So a couple where the woman's age is less than 35 years, after 1 year of marriage, if they have not conceived, or after trying for 1 year naturally if they have not conceived, they should consult a fertility specialist. For women above 35 years, they should not wait this long, but they should consult within 6 months of marriage if they are not able to conceive. So this was about when should you consult a fertility specialist. Most of the times what we come across is only women or only a man goes to the center and get their evaluation done. But we have to understand that the pregnancy requires both egg and sperm to be normal and multiple other things like your hormones, your other medical conditions like diabetes, thyroid, sometimes high prolactin level, or the conditions of the uterus, or any other diseases even in the man, or any habits like drinking alcohol, smoking. So all those things will affect your gametes, and the pregnancy happens when all these things are near to normal. So we need to evaluate as a couple and not as an individual, because most of the times what happens is a man goes to a fertility center, gets his semen analysis done. If by chance there is a problem in the semen analysis, the person tries to go to different centers, take different consultations, but do not visit the center with wife, so the evaluation is incomplete. We may focus only on one individual to later on realize the problems were there in the other person also. So then what happens is you waste a very good important period of your life where the peak fertility is present for women, which is between 25 to 30 years. If you lose this peak fertility time of women, then later on, even if you go for fertility treatments, the outcomes might be compromised based on your age, egg reserve, and many other factors. So it is important to get yourself evaluated as a couple from a fertility specialist within 1 year of marriage if you are less than 35 years wife, or if the wife is more than 35 years, within 6 months. Now coming to ideal age of pregnancy. So ideal age of pregnancy is between 20 to 30 years. But because of current situations or women's career aspirations or maybe other family goals, the pregnancy mostly is delayed beyond 25 years of age. But at least between 25 to 30 years, you should consider having your pregnancy, because the egg number and egg quality is good when you are young. When your age increases after 30 years, the egg number starts declining. Also, the egg quality starts getting compromised. Especially after 35, this decline is very steep, which means the egg number drops quite fast, and also egg quality gets compromised. I have come across many patients who have done their AMH 1 year ago, which is 3. After that it is 1, and within next 3-4 months it has dropped down to 0.3 to 0.2 when the age is beyond 32-34. So this is quite common. So preferably consult a fertility specialist if you are planning to postpone your pregnancy beyond 30 years. You may also consider option of egg freezing if you are not married. When you are young, less than 30 years, consider this option positively, because in later life when you plan pregnancy, you will be conceiving with younger eggs, hence reducing your risk of miscarriage or abnormal babies. If you are married and young but still you don't want pregnancy even after 30, then consider your embryo freezing before 30 years, so that you will have future pregnancy without or with reduced risk of genetic diseases or miscarriages. So this was about the ideal age of pregnancy and when to consult a fertility specialist. I hope this was helpful. Thank you.